Thank you for joining us. My name is Jonathan Alvarado, and I'm going to talk to you a little bit about transition to practice. This lecture is intended for, CRNA residents about to go into practice, new grads, also, preparing for their first job, new, CRNAs that are in the transition of maybe even approaching independent practice or they are already practicing CRNAs and then, looking at ways to potentially be a little bit more mindful of what their practice is or where they want to go. And then the subtitle of the lecture is From Submission to Freedom. And mind that this is not necessarily making a reference of something that is bad or not, or good or better. It's more a mind frame of where you are and where you want to be, regardless of what type of environment you work at. The presentation is free from bias, and the presenter has no vested interest, financial relationship, or commercial support from any product or drug discussed in this presentation. Important to note, I do have a working relationship with Somnia Anesthesia, and then this doesn't necessarily have any interest other than that. A little bit of a background for myself. I think it's important to know where I come from, especially in this type of settings. I'm originally from Ecuador, South America, and former CVICU registered nurse in Florida. I went to Baylor University, nursing anesthesiology program. Currently a CRNA nurse in Sterling State of Washington. As far as the leadership goes, I've been involved in many committees at the American Association of Nurse Anesthesiology, Practice Committee, the Professional Development Committee, Diversity and Inclusion Committee. Same thing in the state of Washington, communications, public relationships, etc. Currently, I'm a commissioner for the Washington State Department of Health Nursing Commission, and also the chair for the Advanced Practice Committee. I'm doing my DNP MBA in Southern Illinois University, and also I'm the executive director for the Society of Obstetric Nurse Anesthesiology and Research, a nonprofit dedicated to improve, advance the obstetric nurse anesthesiology care. Speaking a little bit about what we're going to talk about, the job outlook as far as like high level, what does it look like, and then where are we going with this? The current job market, anesthesia delivery models, employment status, high level difference between W-2 and versus 1099. Some updates to the CRNA education, I think it's important to kind of like keep in mind, especially if you're, finishing up your schooling and you might be starting to get exposed to this in the next couple of years. A little bit on my journey. I think this area might not be interesting for everybody, but I think it's important to know, real life, what is the journey of a CRNA resident to autonomous practice, which is what I work. And then hope you can take something from there. And then, a little mindfulness for the anesthesia provider. I think this is a big topic that is actually starting to become a lot more prominent in this area. And then that's it. So we go. So what is the CRNA job outlook from 2019 to 2020? This is kind of pre-COVID numbers from the government. And then, so bottom line is, CRNA prospective growth, it's about 14%. As you can see there, other professions don't have necessarily the greatest outlook. And, that has multiple factors all the way from how difficult it is to enter these professions and how long they take and things like that. So as you can see, nurse practitioners are are in a really, really good position to grow. Same thing for physicians assistants, and and the nurse practitioner part of areas also includes us. So those numbers are influenced by our growth. And then all occupations in general, 4%. That's kind of like the norm. So as far as the outlook for professions, healthcare professions is great, and our profession, definitely going to grow. I believe this number is going to increase, but this is what we have based on current data. And then, especially now that we're talking about student loans and the cost of healthcare, but at the same time, it's the cost of education. It's important to know, education as a CRNA, it's really expensive. But, looking in the other side of things, we are listed as, top big earners for healthcare professions, and actually in general, as you can see, surgeons, psychologists, psychiatrists, and so orthodontists, and wherever right there, I think I believe is top 15, top 10, which is encouraging. Again, best paid professions. Touching a little bit about the growth in healthcare projections from 2016 to 2020, and again, these are numbers prior to COVID, so potentially this has the potential to even be bigger, the growth. 18% growth for all healthcare professions, about 2.4 potentially more new jobs in the next 4 or 5 years that it comes to be. This is mainly driven by aging population. This is prior to COVID. Now we're obviously dealing with a different issue, or different issues, which are the impact of COVID in the general population of healthcare workers has increased. The retirement trigger for many of them, making it more difficult for hospitals and anesthesia companies or healthcare companies to kind of like hold on to those more experienced providers longer. Also, the locum temporary work market has completely destabilized the staff, like the full-time staff market, and obviously that makes sense. If you're working in a hospital and you've been working there for 10 years, not really thinking about moving out, and then suddenly COVID hits, it's all crazy. We know what happened, and then and now you look at what's going on, and then 10, 15 miles down the road, they're paying you 50% more, 80% more of what you're earning. That makes it appealing for anyone to just move there. And the problem is the hospital where you're working at now needs to hire someone about the same price, and it just has created this. As far as the CRNA goes, or even physicians, we're getting paid well right now, and who knows when that trend is gonna level down. It might not at all. They might kind of find a middle ground somewhere. Supply shortages are a topic that has been talked a lot as far as like the job market goes. It is kind of controversial in a way, due to the fact that there are many aspects in the anesthesia delivery models that could potentially decrease the supply issues, but they're still there. The reality is, we're going to need a lot more physicians and anesthesiologists, definitely CRNAs, and then in our market there are certified anesthesiologist assistants in some areas, which is a CRNA. Regardless of what you think, it is a potential competition, especially in practices that are very restricted, and then AAs can actually play a role in those practices. As a whole global perspective on the supply issues, there are people that say, well, if you make all the practices around the country to be more efficient, full scope, as much as you can, then the supply shortages probably are going to go away. But that depends on more than just deciding. That depends on stay laws, sometimes hospital medical bylaws and things like that. The growing demand, again, provider shortages goes to that, one of them, but the other thing is, aging population. It's a shift on the growth of ambulatory surgery centers, which is, another area of work that potentially CRNAs were not around. They were not around for us to pick on, and that's definitely very enticing sometimes to go from, working in this high acuity, high level. A lot of times the pay, it's not up matching necessarily the market, and suddenly just, a surgical center opens right down the block, paying you more, work is easier, hours are better. So yeah, I mean, that's definitely a demand that is just keep growing and growing and growing. Rural markets are definitely something to look at. This is a lot more autonomous practices for CRNAs specifically, really, especially solo practices in which you're the only person there. They'll be around. The payment scale is a little different, usually more, but at the same time, the scope of the work and it's a little different than just working in your, typical metro area hospital system. COVID impact, like I said earlier, completely exacerbated the provider shortages. And then again, the combination of inefficient usage of the providers at the same time, competition to temporary work. It's what's making it really hard for any of this to go away. And again, this is just increasing the pressure into the facilities and anesthesia practices. And who knows where we're going with this. So where do we start? Well, let's just start in an area in which, as a CRNA resident, as a new grad, even as a already working CRNA, many of us, we walk into this business and in this practice, it's a specialty, and have no idea sometimes what is out there. And even working in the practice, personally speaking for myself, my first practice, I wasn't even sure what it was. And I was working there I worked as a student, and then I worked this as my first job, and I wasn't sure until I asked, and then I understood. So I'm just gonna go through a little bit of a walkthrough on what some of these practices models, anesthesia delivery models look like, and then so hopefully that brings a little light to them. So mainly physician-only practices, which, and depending on what part of the country you are, that are more prominent or not. Historically, in the last 2 to 3 decades, have becoming of a less of a common thing to find, due to the fact that they're really expensive to keep up, and then money as far as like the revenue for anesthesia companies, anesthesia delivery management companies is decreasing. So these practices are not necessarily common, but technically this is no CRNAs around there, no A's around there. It's only physicians that are working every day in their own cases. No supervision, no doubling up. It's one provider, one case, one patient. Same thing goes for CRNA, nurse anesthesiologist only practice. Same model as far as the physician only CRNA practice, no physician around, nobody supervising anybody, billing directly, one provider, one patient, one case. As far as where do these are? Usually, CRNA only practices you find in mostly more like outside metro areas, smaller hospitals, rural for sure. That's just the reality of them. Really good practices to start with as a CRNA, especially if a CRNA resident has experience practicing or training in places like this, you'll really get an idea how that is. I think as a new grad that hasn't had really any exposure to independent autonomous practices, especially like this one, might take a little longer to get used to them. And hopefully these practices have a good orientation or onboarding, because, you know, again, like we talk a little bit later, the beginnings are gold for whatever is the rest of your career. Collaboration, calling CAT, efficiency-driven anesthesia teams. You can call them, there are so many different names that they're using this for. This basically, it is a practice that functions as like a hybrid. They have physicians and anesthesiologists and staff, CRNAs as well. And then these practices are not necessarily there's no supervision, there's no medical direction. It's autonomous work. CRNAs work in their rooms by themselves, physicians work in the room by themselves, and then whatever service the hospital requires, you just add up into them. Collaboration is important in these places. Culture, as far as the colleague culture and relationships are really, really important. The leadership in these places needs to work really hard in keeping everyone respectful, working together and understanding where they come from and what type of practice they deliver. These practices are becoming a lot more common, depending on what the requirements of facilities are, what the requirements of the states are. Anesthesia companies are seeing that this is a really, really, really good model to be, especially in these times in which revenue is decreasing, and you need to make use of every anesthesia provider the best possible way. Again, these practices are usually only MD CRNA practices, due to the fact that you have to be able to practice independently regardless of what room you are in. And then, there are sometimes, coordinators that kind of like help out, and those usually are physicians or sometimes are CRNAs. And then what you find, especially for CRNA residents, the more common teams that you find around in the main hospitals, big university centers, are anesthesia care teams. Historically, physician and anesthesiologist supervises anywhere from 1 to 4 CRNAs, and then in these type of practices as well, you find anesthesiologist assistants. Again, as far as like financial goes, billing goes, they're good for revenue, not necessarily great for sustainability, especially so you look at the whole healthcare as a whole. But they are there, and they're a big important part of our anesthesia delivery models. And we'll talk about a little bit about the difference in a different time, but this is important to understand that anesthesia care teams work in a medical directed model, which means a physician and anesthesiologist is medical directing 1 to 4 rooms. And they have to fulfill all the 7 TEFRA rules. And then, you experience this in general at a different levels of, you'll see sometimes, they get blurry a little bit about what is it? Is it a supervision? Is it a medical direction? And then we'll talk a little bit about difference between them, because it gets really confusing, especially when you're new, a new CRNA or you're a resident, and you just don't necessarily understand what are we doing, where we are. But again, physician only, CRNA only, collaboration, efficiency-driven anesthesia teams, anesthesia care teams. Those are the models that we're working with. Let's touch a little bit on the employment status. So you got a job, and then now okay, so I'm working in a CRNA only practice. Great, this is what I'm going. Or you got a job, and then now you're in a medical directive place, an ACT department, an ACT care team. now what type of model they have, right? Like, are you a full-time employee? Are you independent contractor? And sometimes they can be a little bit scary when you think about independent contractor, because there's a perception that you are just a temporary worker, which is not necessarily the case. So full-time employee, what is that? Well, you get hired by a practice, an anesthesia management company, a hospital, even, and then they offered you straight up W-2 work, which means you are an employee of the hospital, the company, or the group, which is basically the same. And they pay you a salary, usually per hour. And then they pay your taxes. They take them out, all the associated taxes that comes with this, you know, income tax, social security, Medicare. But they also give you benefits, right? I mind that this benefits situation depends on where you go. You know, if you work in a regular small practice, you know, it's very independent to how much money they want to put into the benefits, if they're able to. If you go to a county hospital, you know, they have different type of benefits, like, for example, the pensions, which in reality don't exist anymore. But they also have like matching, you know, your salary matching for retirement. They have 401ks. Healthcare is another big one for a lot of people. You know, they cover some of your healthcare insurance and short-term disability and things like that. So usually these rates, these hourly rates are less, you know, per hour less, because they have to cover these other benefits. There's also other places which is a lot more common, which your salary. So you're a salary for 40 hours and that's what it goes, right? Doesn't matter if you work 36 hours, 34 hours, your salary for 40 hours, and that's what it is. So then on the other side, the 1099 work, independent contractor work. And this is where people get a little confused. You can be an independent contractor and be also a locum CRNA contractor, right? Which means is, you know, you as a locum, you have a assignment for 3 months, 6 months. Sometimes people work a year on those assignments. But you are a contractor through an agency. Usually in the past, it used to be a lot more common to have CRNAs independently going into, you know, providing locum services to hospitals or anesthesia management companies, but that has become a lot more difficult with the time. So agencies are more and more prominent in this market. That's that, right? You get paid, usually it's premium pay because they are desperate and they want something right now as fast as they can, and they don't want to deal with anything else. So that's where you find your bigger hourly rate. At the same time, it is one that is, you know, temporary for real. So they might just say, hey, listen, 3 months, you need to find someone else. We don't need it. We find someone else. Now, the difference between that and independent contractor per se as a full-time independent contractor, that's a little different, right? There are hospitals like physicians, for example. There are agreements with hospitals as independent contractors. They are not employees of the hospital, but they provide a service. Same thing is for us. So we can actually go into a hospital and provide a service as an independent contractor. You have your own company, and that's it, right? The hospital or the practice does not necessarily covers anything as far as like benefits, taxes, absolutely nothing. That's all into the independent contractor. Benefits, as far as like this type of model, well, you know, this is a personal advice that was given by a financial advisor many years ago. And he said to me, you know, the tax code, it's written for companies. And then so when you are a high earner, like us, like physicians, like a lot of many high income earners, that we pay a lot of taxes. The tax system is not made for us. So as far as the benefit goes, you know, I think the ability to create expenses that you can report as an independent contractor, especially in our bracket and our area and the circumstance, it could be a benefit. obviously, these type of things you want to have like CPA be able to advise you on this. Disclaimer: I'm not a CPA, and nor am giving anyone advice about this. But as my own experience, I think that's the reason why some people decide to go this way, and it works. So CRNA new grad or new CRNA, if you have a spouse that has another job and they have a better benefit, sometimes that works perfectly. And then that's the main difference, right? W-2, employee, benefits, somehow packages, the company pays a lot of your tax responsibilities you do pay from your staff, but independent contractors, you're on your own. That necessarily doesn't mean you're a temporary worker sometimes, but you're an independent service provider, either for a hospital, for a company, or for a surgical center, or anywhere they require anesthesia services.